so now I'm going to do the NG tube. Mrs. Jones, have you ever had one of these before?
Yes.
Okay, just a reminder, it's just a tube that's going to help us feed you, okay?
Okay.
Can I get your full name and date of birth?
Rebecca Jones, 3690.
Okay, so I'm just going to wash my hands and begin. First, I'm going to assess your nares for patency and make sure you're able to breathe through them. And can you occlude one nair at a time and breathe for me?
Yes, I can breathe.
Okay, so now I'm going to measure the tubing that's going to be going in. And we're going to measure from the tip of your nose, behind the ear, and down to the xiphoid process.
Okay.
And I'm just going to use a piece of tape to mark where that's going to go.
All right.
Okay. And I'm also going to get just a couple of pieces of tape ready. Okay, and now I'm going to lube my tubing.
No, you're going to apply clean gloves.
Okay, so now I'm going to apply clean gloves.
After I washed my hands.
What?
Wash your hands.
I already did that.
Oh, okay.
I said that.
All right.
So now I'm going to apply clean gloves.
What's wrong?
It's just pissing me off. Okay. Did that. So now I'm going to apply my touching the fucking paper. Okay. So tape. Now I'm going to apply clean gloves. And put my tube in lubricant. Okay. Miss Jones, this is just a cup of water for you to swallow, okay, while we're putting the tube in. Can you lean your head back?
Okay.
Okay. I'm just going to insert the tubing, just a few inches, and now I'm going to check for coiling, and I don't see any coiling. Okay, so now I'm going to bend your head forward, and can you sip this water while I insert the tube?
Okay.
Okay, so sip, 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 sip. Okay, so we're at where the tape is. Okay, so I'm just going to check the placement of your tube. I'm just going to tape this to your cheek really quickly. Okay, and there was no gagging or coughing. Do you feel okay?
Mm-hmm.
Okay, so now we're going to check placement. One way we could check placement is by the tape that we marked, and it did go in. Are you able to speak?
Yes.
Okay, and I'm going to check once more for any coiled tubing. And I don't see any coiled tubing. I could check the pH of any aspirant. And I'm just going to take 10 milliliters of air and inject an air bolus. And with my stethoscope, I'm going to listen for a swishing sound.
While you injected.
And I'm listening while I inject the air bolus. I could also call for a chest x-ray, and I could measure the amount of exposed tubing from the baseline, which we did. Okay, so the placement is good. So now I'm just going to anchor the tubing to your nose. Okay, does that feel okay?
Yes.
Okay, take this off of your cheek. Okay, and I'm also going to clip it to your gown so when you move it doesn't go anywhere. and I'm going to attach the tubing to a low intermittent suction, and we'll perform oral hygiene every 2 to 3 hours. Okay, so now, how are you feeling, Miss Jones?
Fine.
Okay, so I'll be back to check on you. Okay?
Okay.
So I wash my hands, leave the room, make sure my bed is lowered, make sure Miss Jones has everything she needs, and I would document the time, the length of the tube, which is 50 inches, the size of the tube, which is a 12 French, the pH value, if I was testing that, the type of tube, any color consistency of the drainage, the intake and output, and the drainage amount. And I would use, I would come back to implement my irrigation, and I would use I would obtain gastric secretions, check my placement, irrigate, and measure and check the color and consistency of my irrigation of the tube.
Okay.
Okay, that's it.